Hello and welcome to this week's edition of Health Matters. I'm naturopathic doctoral candidate and registered holistic nutritionist Erica Robinson, and I'll be your host tonight. On tonight's show, the topic is moving right for health. We have three great guests that specialize in movement: a registered physiotherapist, an osteopathic manual practitioner, and a certified kinesiologist. Joining us first on the show is registered physiotherapist Victor Von Pakti. Victor is the clinic director of the Westwood Physiomed Clinic in Etobicoke. He holds a degree in kinesiology and health science from York and a master's in physiotherapy from DeUville College in Buffalo. So thanks so much for coming on the show, Victor.
Thank you very much for having me.
Great. So I think the very basic question, a lot of us know what physiotherapists do, but can you just tell us basically what does a physiotherapist do?
Okay, to begin, physiotherapists are regulated healthcare professionals. We combine a knowledge of the human body with clinical specialized hands-on skills to help assess, treat, and diagnose conditions that are related to the neuromusculoskeletal system. So in essence, any condition that's related to the nervous system, so your nerves, your muscles, bones, and joints.
Wow, okay.
Yeah.
And so that's another question I had, was what specific conditions do you treat then? We know that it pertains to those systems, but can you give us some solid examples?
Yeah, conditions, there are a wide range of them. They range from nerve impingements to migraines to your general ache, strains, muscle pulls related to either work-related injuries, athletic injuries, car accidents. So it's a wide scope of things, and physios work in all sorts of different practices. So we include outpatient practices like myself. We work in hospitals, we work with sports teams, the works, pretty much all over the place.
So we can find physiotherapists in many places.
Many places, definitely,
Wow.
definitely.
And maybe shed some light for us on what the educational requirements are to becoming a registered physiotherapist.
Right, so physios begin with a undergraduate degree. Generally, a lot of physios will come in with a Bachelor of Science degree. And after that, you move on to the master's program. So you get your master's in science. And in the States now, they have phased out the master's program and have now made it a doctoral program as well.
Oh, wow.
Yeah.
So you would have, I guess, a PhD?
It'll be more of a clinical doctorate, so it's called the DPT, the doctoral doctorate of physical therapy.
And then I'm assuming there's some kind of licensing exams too to practice in Ontario.
Definitely. We go through a rigorous process. There is first a written board exam and then a practical component, which is very nerve-wracking.
Really?
Yeah.
Well, it's good to know that you guys are very regulated. It keeps Ontarians safe and definitely people in the region of Peel safe. Another question, I've worked in the physiotherapy realm for about 2 years, and one thing that I find was frequently asked is physiotherapy covered by OHIP? And I know that there is a segment that is,
Right.
and there's also a part that's not. So can you tell us a bit about both of those worlds and what the difference is?
Right. The general population would fall into the population that is not covered by OHIP, and unfortunately. The majority of people seek and get covered by private health insurance, essentially. So if you work for a workplace and they have private health insurance, you would then be covered for an X amount according to whatever the insurance covers for you specifically. When OHIP does cover physiotherapy, it's for individuals who are under the ages of 18 or over the ages of 65. And if you do fall within that age classification, you still have to fall within a certain number of conditions. Generally, you'd have to have a critical condition that would warrant ongoing physical therapy treatment.
Okay.
If you're over 65, generally it's for individuals who are in nursing homes or residents of nursing homes.
Okay, and what about hospitals?
Hospitals, it is covered. During your entire stay throughout the hospital, you are covered for physiotherapy.
And you mentioned earlier that physiotherapists do diagnose.
Yep.
Can you tell us about what kinds of things you diagnose, and do they prescribe drugs, pharmaceuticals, anything like that?
At this point, we do not prescribe any type of prescription drugs. The talks of possibly allowing that in our scope of practice is there, but it's not imminent in the near future, at least. At this point, we have just been able to diagnose conditions, and those conditions that we would diagnose would include whiplash-associated disorders, lumbar pain, patellofemoral pain, meniscal injuries, some conditions that we can diagnose while in the clinic. There are conditions that would warrant a further medical follow-up, which would include an X-ray and MRI, to get a more definitive diagnosis as to what physiologically may be occurring. But in general, yeah, those are the conditions that we can diagnose.
And so I'm guessing you work well within an integrative network so that you can refer patients if they need further treatment or diagnosis, I should say.
Definitely, definitely. The main thing with physiotherapists is the fact now that we can diagnose, we must understand our role in the healthcare realm. We are primary healthcare providers, meaning patients can come in off the street and see us specifically for one of their conditions, whatever they're ailing from. However, if it is a condition that is a little more complicated in regards to maybe it's a systemic condition and not so much just a shoulder pain, let's say, we would then work very closely with their family physician or their healthcare provider and seek more in-depth follow-up medically as well. So we're all a part of a healthcare unit or healthcare team.
Oh, that's great. And I'm guessing there's a lot of intercommunication between yourself then and the family doctor
Definitely.
at that point.
Yep, definitely. It's a relationship that we like to have ongoing. That way, the primary healthcare provider, who is the family physician, would then understand exactly what's occurring on our end of it, at least. So we always like to maintain that open dialogue.
Excellent. And now you are the clinic director of PhysioMed Westwood.
Yes.
So can you tell us a little bit about PhysioMed's whole health approach to healthcare?
Okay, our whole health approach, we utilize multidisciplines. So that would include professionals like kinesiologists, physiotherapists, massage therapists, chiropodists, which are foot specialists, chiropractors, and we're actually looking into other possible healthcare providers as well, like a nutritionist, potentially a naturopath. So our whole health approach is looking at the individual as a whole from different walks of the healthcare realm and finding out what is the root cause of their condition. So if you come into the clinic with a low back pain and you said, you've been treated for this numerous times, you're taking numerous medications for your lower back pain, but that pain is still there, we'll take it a step further. So why do you have this back pain? Are you constantly lifting something? Is your posture bad? Is your core weak? All those little conditions that definitely play a role in low back pain, we look at addressing as a whole.
Oh, and here's a picture of you, I guess, doing one of your assessments, right?
Yes, that's right there. I'm teaching the patient how to properly perform a squat to help minimize pressure on the knee.
Great. I think we've got some more pictures coming in too of your clinic where you work. That's excellent. And how have you found the whole healthcare approach, or how have you found working with a variety of practitioners? How has that impacted the patients at your clinic?
Well, with the whole health approach, it really works well with patients. I mean, there are a lot of clinics that do the same, in essence, the same type of whole health approach, but we take it a step further. In addition to utilizing specialties from different disciplines, we also are looking at not only being reactive in the sense that you came into our clinic for a condition and we're going to treat that specific condition, but as I mentioned, we want to treat it as a whole. So what initially caused that condition, how can we treat it in the present, but also how can we prevent it in the future? And that's where we take healthcare in a little step further and really help improve individuals' quality of life and overall well-being, because not only are you feeling good today, but we're also going to ensure and help improve the likelihood of you feeling better tomorrow as well.
So preparing them for the future and to stay healthy throughout their lives.
Yep.
Excellent. And what can a patient typically expect with this approach? Do they see several assessments on the same day when they first come into the clinic, or what would they be expecting?
With our clinic specifically, we don't want to overwhelm a patient. If they came in with a condition, we'll ensure that they came in and get that condition treated as soon as possible. If the condition is a little more complicated, we'll ensure that we'll have other input from other healthcare practitioners in our clinic as well. But our initial assessment process is fairly in-depth. We look at the individual doing a musculoskeletal exam. So we'll look at how your body moves, how your posture is like, how your skeletal system is like. We'll do surface EMGs, which will measure the muscular contractions along the entire spine. Gait scans, even to look at how your feet are functioning while you walk. So it is in-depth, but we like to make it as streamlined and as efficient as possible.
Wow, great. Another thing I wanted to cover is, let's talk about the difference of physiotherapy to treat athletes versus, I guess, the general public or lay people. What differences are there?
Generally, the approach remains the same. We want to, the goal of the physiotherapy profession as a whole is to ensure that we can help maximize your quality of life and maximize whatever activity it is that you do. So if you're an athlete, our focus will switch slightly. We'll look at, okay, you came in here with an injury, let's get you out of here without the injury, Let's keep you injury-free so we can prevent injuries, but also
Good idea.
a good byproduct of that approach is better overall athletic performance. With the general layperson, let's say you are an office worker. Okay, you came in with migraines. We'll treat those migraines, find out what's causing those migraines, prevent those migraines from becoming something more serious like nerve entrapments, numbing and tingling down the hands and fingers, severe migraines with auras where you have to lock yourself up in a dark room. But also, you know, I find out that you like to golf on the weekends. So we'll help ensure that we keep you pain-free, but also how can we maximize whatever activity that it is that you do, right? So if you're an athlete, if you like to do simply taking your dog out for a walk or simply playing with your children, that's extremely paramount with a lot of people, obviously. We'll ensure that our program is tailored to allow you to do those things pain-free.
So it seems very individualized and as though you're
Yes.
focusing on the patient's goals. That's great. One thing that I had seen too in one of your pictures was that you offer acupuncture services.
Yes.
So did you require additional training to be able to offer these services?
Yep. With myself specifically, I did my acupuncture training through the Acupuncture Foundation of Canada.
Okay.
The scope of practice with acupuncture in physiotherapy is to treat musculoskeletal conditions. So it's the approach is known as medical acupuncture, and with that, we're treating low back pain. We're treating nervous conditions. We're treating muscular strains and aches and pulls. So yeah, it's been actually a really good thing for me when I decided to take the program. Yeah.
Which conditions do you find that's really helped with or impacted?
Specifically migraines. I treat people day in, day out with migraines.
It's a growing problem, migraines.
It is. It's a growing problem mainly because of our sedentary lifestyles. Right?
Really?
When it comes to office workers, truck drivers, taxi drivers, even with children, I really focus on posture significantly because now they're sitting on the couch playing their little PSP.
Yeah,
we're on
that's
their
right.
laptops and we're all hunched up in this position. A lot of us now, I'm finding at least in my clinic that a lot of people are coming in with headaches and migraines, and I use acupuncture in addition to all the conventional forms of therapy that I normally do as a physio, and I find that it works really well.
Wow, that's excellent. And that's good to know about the migraine thing, that physio can treat it and
Yeah.
acupuncture can treat it as well.
Definitely.
Now, one question I do have for you before we go is, working in the physio field, I would often talk to people on the street and recommend physio, and one of their complaints was, oh, I'm afraid I'm just going to go in and have a machine slapped on me. So what would you say to that? Is that typical, or what can patients more so expect?
Unfortunately, in the past, there have been a lot of facilities that do just put on a machine and have the patient leave. But our approach is, I like to tell patients that healthcare should be approached like a cake when you're baking a cake. You need your eggs, your flour, your water to make that cake. The IFC, or putting people on machines, is one component of treatment. In order to get them better, we have to not only add in that component, but also look at them as a whole and add in as much things as we can to get them pain-free.
Great. Well, thanks so much for coming on the show and shedding
Thank you
some
so
light
much.
on physiotherapy for us, Victor. When we get back, we'll be with osteopathic manual practitioner Lydia Henry. Welcome back to Health Matters. Today we're discussing moving right for health. Joining us next is osteopathic manual practitioner Lydia Henry. So Lydia is not only an osteopathic manual practitioner, but also a certified athletic therapist, and she's been working in the rehabilitative world since 1996. She currently practices at the Lakeside Natural Health Center in Port Credit, Mississauga. So welcome so much to the show, Lydia.
Thank you.
All right. So perhaps the first thing I want to know, because osteopathy and more so osteopathic manual practitioners are maybe a new thing to the public, can you tell us what osteopathy is?
Sure. Osteopathy is a type of treatment that will look at areas in the body that are restricted or are constricted, and we are going to go in and try to ease that by using our hands. So it's all hands-on manual type of therapy. We use the anatomy, we use the physiology of the body. We try to understand as best as we can where is this injury or this pain or discomfort is coming from. And so our goal, every appointment, our goal is to try to get to the bottom of where this is all coming from.
So trying to seek out the root cause, essentially,
Absolutely.
instead of just medicating the symptoms, we're
Absolutely.
focusing on the pain area. And what are constrictions or restrictions when you refer to those?
For example, it can be a joint that has a lack of range of motion, whether due to injury or it's crept onto the person, they're not really sure where it's coming from. You got to restore that. You got to restore mobility to a joint. You got to restore mobility to tissue. It's the only way that a tissue or a joint is going to be healthy enough to heal itself. So, yeah.
And why is it important that people have full range of motion or have that ability to move their joints?
Well, as you're born and you're a little, a toddler, and you grow up and you do all these things, you do sports, you have accidents and so on. Your body over time, all these little events will restrict areas in your body because of injury or inflammation or scarring and so on. And your body constantly adapts and adapts and adapts and adapts. And at some point your body says, I'm done, I can't adapt anymore.
No more
So
adapting.
yeah, and then this is where the pain sets in and so on. So a part of the body needs that mobility to go back to its original, health. So if all these areas are mobile, that person can start to heal again. So it's really important that everything in your body is mobile, has vitality, is able to move and breathe, well.
So restoring that range of motion so that we can address the injury, essentially, or whatever's going on in the body.
Yeah, you restore that mobility so that body starts to heal, starts to understand I should be in this position, and the pain subsides, biomechanics become better, posture becomes better.
Excellent. And perhaps you can tell us, where did this modality develop from and how old is it?
Andrew Taylor Still is the founder, and this was in the 1800s in Kirksville, Missouri, and he was a physician. He lost his wife and a number of his children to diseases at the time. And
and there's a picture of him
yes,
too.
and he felt that medicine at the time was just not cutting it. There was something missing. So he went back, he studied his anatomy all over again, he studied his physiology all over again, and started using hands-on treatments to increase flow, circulation, vascularity, and so on. And he was getting amazing results. And slowly, everybody started to find out about it, come get treatment. And he opened the first school in 1896, and it's been there ever since.
Oh, great. So it definitely sounds like a very hands-on approach. So the
Yes.
practitioner is very involved with the patient,
Yes.
or the client, I should say. Who specifically can benefit from osteopathy?
That's a good question, because really the answer is anybody. Anybody with, old pain, new pain, unidentified pain, where's it coming from, unexplained. I often get in my office people who've it's just things haven't worked out, and I'm sort of, the third, fourth sort of person. And it's really interesting because it's like a puzzle that I have to figure out, what are we missing here, So
Okay.
anybody.
And what about if you think that you're in a good state of health, and do people see osteopaths or osteopathic manual practitioners for that, just to keep in balance?
Yes, I have often patients who are doing great after, a certain amount of time, but then, they do come back and they, say, I've been feeling a little bit lethargic, or I've been feeling, I've got headaches are sort of creeping up again, and we just rebalance a lot of things, and usually it's great.
Make sure the body is functioning well.
Exactly. If they've had a little accident or something, they know they come right away, and not to wait till the body's can't adapt anymore, and then they've got pain.
Wow, I wish we could say that for everyone, because the
I know.
best time to address something is right
I know.
after it
But
happens.
we don't always address it unless it's painful.
It's
so,
true.
Yeah.
It's true. Can you tell us a bit about the educational background to becoming an osteopathic manual practitioner?
Sure. In Canada, there are several schools, but the school I went to, which is the Canadian College of Osteopathy, that was a 5-year program plus 2 years to do a thesis and present it in front of an international jury.
Oh, wow.
Yeah.
So quite extensive.
Yes.
So I know at this point it's not regulated yet. Anything in the future for that, or does it
They're
matter?
working very hard on it. The Ontario Osteopathic Association of Osteopathic Manual Practitioners, they are working very hard on getting that done, yeah.
Oh, good to know, good to know. And what can a client typically expect on their first visit of seeing an osteopathic manual practitioner?
The first visit usually is an assessment, a really intensive history. So I try to go as far as possible, you know, from birth even. You know, if they know any
Really?
stories of how their birth was, any surgeries I go through, you know, if you had surgeries, if you had car accidents, if you had any of that. And I try to figure out a picture of this person and what they've been through, and then look at their present pain or their present problem. And then we do an assessment, biomechanics, posture, and so on. And then we start treating as soon as we can.
So even, say, somebody in their 60s or 50s, what they went through in childhood could still be impacting their health today?
Absolutely. Children who've had surgeries, for example, that scar has caused this one restriction in one area, and your body has had to work around that for 50 years. At some point, something's going to happen. You know, something's going to give, and a lot of times, if they don't divulge that information, we go around in circles. But eventually, we get it, and it's like, oh, you know what? Let's go back to that root and see if we can open that area up. And then a lot of times, that's the key.
That's really interesting. And one thing that we were talking about before the show was about scar tissue and how that
Yes.
impacts the ability to heal. So can you perhaps tell us a bit about what scar tissue does? How do we get it, and how does it affect us?
Right. Every time you get hurt, you have inflammation. Inflammation will bring on scar tissue, and scar tissue is just kind of like, I like to explain to my patients, kind of like glue over time. And your body is an amazing machine, but it tends to sort of throw this glue on, and it's very mishmashed, and so it ends up holding a lot of other structures together, and so it becomes a really tight area, and it becomes a very restricted area. And so if you imagine that your fascial tissue is kind of like a bodysuit that you wear, one bodysuit that covers everything, and you've got one restricted area, you can imagine like the lines of pull. So a very common one, for example, is an appendectomy scar. It doesn't matter when you got it, but you're going to have this line of pull to that right side all the time.
Towards where the appendix was?
That's right. Often you get patients with neck pain or shoulder pain, and they don't know where it's coming from. Over time, that shoulder's had to change its biomechanics, and then it's been irritated now because it's not in the right place while it's doing all its work. So clearing a lot of that pathway and a lot of that tension opens up, it opens up the tissues, and all of a sudden, you've got better posture and so on.
It's funny because most people would probably never think, oh, my neck or shoulder pain is connected to
I know.
an appendix removal I had years ago.
There's always that look of like, what are you talking about? And then you sort of explain it, and you show them the anatomy, and it's as soon as they see it, they're like, okay,
Makes sense,
yeah,
right?
Makes sense, yeah.
Wow. And so we've talked about the assessment. What can we expect in ongoing treatment sessions?
Well, ongoing treatment is going to be really every session. You see how the person's progressed from the last session. If anything new comes up, you address it. If not, I always have a plan in mind. What are the areas I found in my first assessment that have been restricted? I can't always address all of them in the first treatment or second. So I sort of have this running list. I got to make sure this is mobile. I got to make sure this is mobile, and we go on. But the patient really helps. You got to really listen to the patient and see what they've sort of developed. And sometimes you take away one restriction and something else shows up underneath that was never there that first time you saw them or the second time.
Really?
So you've got to readjust as you go, for sure.
So kind of undo the layers and get back to how it used to be.
Exactly.
And how many sessions do patients typically need to start seeing results, or how long is the entire treatment plan usually?
Well, that's a tough question because everyone is so different, and their life has been such a different accumulation of events. So I'd like to see someone say, I'm feeling better within the first 3 or 4 treatments. If I'm not getting something, I'm really got to change gears and look around and see what am I missing. But to give a number, I would never be able to tell that.
It's too unique to the patient.
Absolutely, yeah.
Another thing I was wondering too, we do have, I think we put up a slide at one point of all of the conditions that osteopathy is good for. What are some, so we've got them up there.
Yeah.
And I know I was surprised by things like digestive disorders. It's more obvious when you think about neck pain, back pain, but do you have any success stories of people who were helped in a way by osteopathy that they never would have thought, or you never would have thought would have helped?
Yeah, absolutely. Well, if you know your anatomy when it comes to where your organs are and what tissues attach your organs to your skeleton, to your muscles, to your ligaments, and so on, you can't dismiss the relationship between somebody who's got an inflamed colon, for example, like IBS, and back pain. And so sometimes this back pain is ongoing and they don't realize it's from that. So you treat the inflammation, you treat the scarring that's been happening over years due to the IBS. All of a sudden they're going to the washroom more often. They've got healthier bowel movements. They've got less back pain. They've got less shooting pain down the leg, or even knee pain that is unexplained often comes from something as simple as IBS, because the tissue down the leg is attached. It's the same tissue that goes around the colon and attaches.
Right.
And if you release some of that tension, then all of a sudden their knee is moving a lot better, and they're doing so much better, and they've got more range and less pain.
So again, it's just like you would never expect, oh, my knee pain's related to my IBS.
Yes.
But really it's just a matter of anatomy.
Absolutely.
Wow.
Absolutely.
And I think maybe just briefly in the last minute of the show, can we talk about the difference between doctors of osteopathy, which practice in the States, versus osteopathic manual practitioners, which are here in Canada?
Yes. So the osteopathic doctors in the U.S. are medical doctors, and they perform acts like surgery, medical, drug prescription, and so on. But they do spend an amount of time on manual therapy, which was the intent of Dr. Still from the beginning.
Right.
Outside of the U.S., through Europe, Asia, and everything, they've really, all we do is just the manual. So we concentrate on that, and that's why we're called osteopathic manual practitioners here and not doctors of osteopathy.
Makes sense. Well, thanks so much for coming
You're
on the
very
show,
welcome.
Lydia. I love learning about osteopathy.
Thank you.
Don't worry about me. I'm not delicate.
I'll just throw that over your shoulder for now.
Cool.
Can you throw that in your pocket?
Not working?
You hear it?
No, I'm not hearing anything. It's okay. I'll live.
We're back in the second half of Health Matters, where we're talking about moving right for health. Our next guest on the show is certified kinesiologist Sam Jarman. Sam has a degree in kinesiology and health science from York, and he's currently practicing at Physiomed Burnham Thorpe Clinic in Mississauga. So welcome to the show, Sam.
Hi, thanks for having me.
No problem. So Sam, tell us about what is kinesiology, because I know for a lot of people that sounds like a pretty funky word.
Yeah, it's a pretty long word. The definition is actually a lot simpler than the word may entail. It's simply the study of human movement, and it's a pretty broad statement, but that's all it means. It's simply the study of human movement.
Well, that's right. It is a very broad statement. And one thing I wanted to discuss is kinesiologists can be found in a multitude of settings. We've invited you here today to represent the clinical world,
Yes.
but where else can we find kinesiologists?
Quite a few different places. There's a lot of kinesiologists working in with the insurance world in accident benefits and claims and whatnot, doing functional ability evaluations, return to work programs. Also, obviously in the clinical setting, there are kinesiologists that will work with athletic performance and training. To name a few, there's a lot of others, and unfortunately, they're not all coming to my head right now, but quite a few.
Very broad. We
yeah.
can find them all over Canada.
And actually, sorry, just another one I just came to my head is ergonomics.
Oh, good to
Ergonomics as
know.
well. Yeah.
Good to know. And what are the current requirements in Ontario to becoming a certified kinesiologist?
There's actually some interesting stuff going on right now. I'm certified by the Ontario Kinesiology Association. At the moment, there is a transition towards the College of Kinesiologists of Ontario because we're going to be regulated very shortly, likely in 2012 under the Registered Health Practitioners Act.
So just like medical doctors, physiotherapists, that kind of thing?
Under the same umbrella. So having a license to practice and requirements. To be a certified kinesiologist at the moment, through the Ontario Kinesiology Association, you have to have a bachelor's degree from an accredited university with certain academic requirements. The requirements will probably be very similar when the college is actually in place. There's a review process happening right now that people can check out online if they care to. It's College of Kinesiologists. Just Google that and you'll find it, and it's up till May 31st for review. But basically, you have to have your bachelor's degree, and you have to have certain educational requirements to be certified.
And so what specifically can we find you doing in the clinical setting as a kinesiologist?
Myself, I do a wide variety of things. One of the primary things that I end up doing is rehabilitative type stuff. So people who have injuries or have pain, I'll work with them through exercise, through human movement, through body movement, to try to rehabilitate that, return ranges of movement, reduce pain, things of that nature. Also, I do work with prehabilitative type stuff, so to make sure that as you go forward, you don't injure yourself, making sure your behaviors are correct, and that sitting at a desk for 8 hours a day isn't going to make your back hurt.
Yeah, and I think that's a common complaint many of us have working the desk jobs.
Yeah, unfortunately it is. I'm trying to be a decent example and sit fairly upright, but a lot of us will sit at our keyboards hunched over.
Hunched over position.
Yeah, being a student as well, again, I'm in that position quite a bit.
So can you tell us briefly maybe what kind of problems you're seeing patients come in with because of the desk job and the constant leaning over?
There's a lot of people who will just end up having simply lower back pain and fatigue in the lower back muscles. So as far as diagnosing the condition, it's oftentimes a kind of a nebulous diagnosis. Quite often people who are at desk jobs will be diagnosed as having upper and lower cross, upper cross being in the neck area, a head extended position. A lot of people will say tight pectoral muscles, but when I end up looking at that, it's not always the case. But aside from that, just generalized pain and fatigue because of immobility.
Wow, and that's something that you can address as a kinesiologist.
Yeah, definitely. There's certain just kind of simplified protocols that I can put people through, just make them more active. Also specified movements if they're required. If not, then a general movement protocol is usually pretty efficient for most people, because most people that are stuck at desk jobs just don't move.
That's very true. And you give them actual recommendations that they can put into place at work, for instance?
Yeah, for some people, they're sitting for long periods of time, so one of the things that is often suggested is if you're sitting at your desk for 20 minutes and it starts to hurt, well, stand up and move around, get some blood flowing, get some, fluid flow, fluid exchange to help reduce some of that inflammation. One of the easiest ways to reduce inflammation is simply to move, because inflammation is often a stalling of fluid, so we just want to make sure it moves. So stand up every 20 minutes, take a 5-minute walk, walk to the photocopier, walk to the printer. If you have a printer at your desk, maybe move it.
Give yourself a bit of a walk.
Yeah, just different little things. You got to work with each individual and find out their specific needs, their specific requirements, and try to have interventions that make sense for them. You know,
Right.
there is no one-size-fits-all protocol, unfortunately.
Good to know. And I mean, I think a lot of people don't even realize the fact that sitting, all the gravity is going into your lower back, whereas standing, it's going into your feet. So that's probably a big contributor of the back pain.
Yeah, most definitely. I mean, you're sitting on your ischial tuberosity, so you're sitting on your like your butt and your pelvis and whatnot. What ends up happening for a lot of us is some of us may get caught in lumbar flexion, so the lower portion of our spine may hunch forward, putting a lot of
okay.
stretch on the low back muscles. Some of us may really lean back and put a lot of compression on our lumbar, our back extensors. That can lead in both directions to just a little bit of pain over time. When we adapt to a position over a long period of time, the adaptation is good for stability, but over a period of time, eventually we'll break down and we'll start to have pain. So the pain isn't the problem is the adaptation.
Okay, it's the adaptation.
Yeah.
Maybe let's deviate for a second too and talk about what exactly is the difference between a kinesiologist versus a personal trainer.
You know, no knock on personal trainers, but the simplest way to explain it would be the depth of education.
Okay.
There's quite a few personal trainers out there that really take pride in what they do and really deeply educate themselves on what they do. But the requirements are a lot simpler. Anybody can unfortunately walk off the street, take a weekend course, and pass a test, written and practical test, at which point they would be certified and insurable as a personal trainer, which leads to the possibility of having a personal trainer that doesn't have a huge amount of qualification. Also, personal trainers quite often are working in the world of physical appearance. Kinesiologists are working more so on a health basis, structure, function, making sure that things are working appropriately for health and for longevity. Kinesiologists definitely work in performance-oriented goals and can definitely work with appearance-oriented goals. What often ends up happening, though, is, again, just to revert back to the education, kinesiologists, especially a certified kinesiologist, is required to have a 4-year education at the university level, which many personal trainers have. However, some may not. So there's just a quality assurance difference.
Okay.
But there's some wonderful personal trainers out there whom I know and really appreciate the work that they do.
And you were talking a bit about goals too. What do you find are the common goals that your patients are coming to see you to achieve?
Quite often in the clinical setting, people are coming to reduce pain and improve function.
Okay.
There is definitely in the clinical setting room for physical performance goals, improving performance, be it athletic or just lifestyle. Also, there are people who have metabolic derangements, such as type 2 diabetes or possibly syndrome X, kind of
And that's
nebulous
what I
term.
wanted to talk about too. Kinesiologists can actually work with these specialized populations.
Yes.
Okay.
Kinesiologists do definitely receive further training than other health professionals may. It's not to say that they don't have it, but quite often kinesiologists kind of get slammed in the head with books about diabetes and what exercise can do as a positive intervention. So we definitely do work with specialized populations, as I do see in the clinical setting at times.
Okay, and what about weight loss? Do you find that you're seeing a lot of patients for weight loss goals?
Yeah, the patients that I'm seeing for weight loss goals it's a little bit more clinical. Clinical meaning it's more about the health and the function of the body. So somebody with a little bit of metabolic derangement, such as type 2 diabetes, excess fat around the abdomen being a little bit more of a health problem for most, I definitely end up dealing with that. And I deal with it on that end of the spectrum, not because somebody is in there to look good, but if we lose a little bit of weight, for a lot of us, we look a little bit better, feel a little bit happier, reduce our stress,
That's right.
reduce our cortisol, and reduce our metabolic derangement, which is great.
And one thing that we were talking about earlier was the problem with chronic cardio. So can you tell us what is chronic cardio? Why is it a problem? And why isn't it helping people lose weight?
There's a term, it's a newer term out there. A lot of people haven't necessarily heard it before because everybody quite often hears that, I want to lose weight, I'm going to do a ton of cardio. Cardiovascular exercise is wonderful for heart health and for lung health. However, for weight loss, it's primarily a fat-burning modality. So what ends up happening is you train your body to use fat stores. So you want to make sure that you're not going to conk out during exercise, so you're going to change the metabolic pathways and use more fat. So you're going to store more fat. Also, over longer periods of time, cortisol, which is a stress reaction hormone, is a great hormone for fight or flight, for survival. However, in our current state, when we are bathed in stress hormones all the time because of our daily lives, having an additional physical stress of long periods of exercise, long bouts of exercise, will raise that cortisol. So you're doing great for your heart and your lungs, but you're probably not burning any weight and any fat on account of the fact that your body is getting adapted to work on fat stores. So you're going to make sure that you hold on to them because your body is built to make sure that it doesn't die.
So it's basically continuously replenishing the fat stores instead of getting rid of them because it's used to burning them.
Yes, so you're upregulating that pathway and you're making it work a little bit better just so that you make sure that you're adapted to the exercise that you're asking yourself to do quite often.
And about the cortisol too, that's a hormone that we know stores all that fat in the belly area, and
Yeah.
it's the very unattractive apple distribution with that.
Yeah, it's very true of men and women. So oftentimes, people will think that women tend to store primarily fat around the hips, and that's another, axis that we don't need to talk about. But primarily, that's estrogen. For cortisol, it's a little bit more common for most of us because of the stress in our daily lives.
Stress levels, that's right. And I know that you have a differing opinion about core work. So there's been a recent fad, maybe it's a longer standing fad, but let's work on our core.
Yeah.
And a lot of people say you've got back pain, core work. So what's your opinion and why is it different?
Well, my opinion on core work is that it's kind of as a buzzword, as a fad, it's very reductionist. The body is a single unit and it works as a single unit. If we try to reduce the movements, we're going to train to reduce movements. So we're going to train to do very specified movements. In some cases, that's good to remove certain imbalances. However, core work is very, very regimented, very specified. And the way that a lot of people apply it isn't very functional. What we're looking at is muscles that attach around the pelvic girdle, so around the hips, above and below. So your legs technically are also part of your core. And to reduce it and not recognize that muscles that attach above and below directly affect what's going to happen in the back is a very reductionist thing. And I don't think training anything less than the whole body and looking at how the whole body moves as a unit is much of a worthwhile thing. So it has been shown. There was a paper by a gentleman named A.L. Letterman. It was kind of an overview paper about core training. And one of the things that was shown, and his paper's been picked apart and there's criticism for everything, but one of the things that he showed very well was that there were general exercise programs that work just as well to reduce low back pain as a specified core program. So core programs can be great for some people, and for other people it's just too reductionist and it won't take them past the basic stage.
Okay, so that's very interesting because you're saying core is not just the six pack, but it can also be our leg muscles.
Yeah, a lot of leg muscles, including your glutes, so your quote unquote butt muscles, they attach below the hip and on the iliac crest, so the top of your hip bone, and they will affect where your pelvis sits. If you affect where your pelvis sits, you affect where your lumbar spine sits. So it's a chain reaction. You cannot do anything in any part of the body without directly affecting almost your entire body. So we just, my preference as an individual is to not reduce it, is to try to get people doing full range of movement through all kinds of different activities.
Well, that's great to know. So when we come back from the break, we will be joined by Sam to actually do an assessment.
Yeah.
We'll see you back then.
Thank you.
Welcome back. We're on our final segment of Health Matters where we're talking about moving right for health. Joining us now is certified kinesiologist Sam Jarman, and he's going to show us what a kinesiologist assessment looks like and why it's important to see that we're functioning properly, not only for health, but also for things like weight loss. So Sam, tell us a little bit about what you're going to be doing.
Okay, so primarily the purpose of an assessment in any situation is I can't really try to assign exercises or assign improvements or interventions without knowing what's going on. So I do oftentimes have to go through some form of assessment procedure so that I can see where the issues with an individual's movement are. If I don't, again, just to go back to it, if I don't know, I can't work with it. If I don't know what it is, I don't know which direction to go in. So oftentimes, the easiest way to look at it is movement. We can get an idea as far as what's going on with somebody in static findings. Having them stand still, stretching them, like myself, moving their body parts around. That isn't as accurate as knowing how far they can move on their own. Because I won't always be there to pick their feet up and move them, so I need to know if they have the range of motion available to themselves. If they don't, I have to find a way to get it to them. We can go through all different kinds of movements and figure out where the chain may be breaking down. When we figure out where it's breaking down, we can then, take a global picture. We got to step back. I can't look at, if somebody says they have knee pain, I can't just look at their knee. I have to look at the whole body and how it's interacting. Again, as a kinesiologist, it's human movement, and I don't look at the body as specific pieces. I look at the body as a full unit. So, I brought along a young gentleman that I actually train, Julian Spencer, and he's going to demonstrate some of the movements that I will often go through. Depending on a specific situation for a person, I may end up doing different movements, but that would come out and I would figure out which way to go when I do a client interview. When I run through all the questions, figure out where their pains are, where their concerns are, what their goals are, then I would figure out how I would assess them. But again, it's primarily movement based. So what I'm going to do is use a very simple piece of equipment such as a TheraBand, and oftentimes I would use a dowel, but use what you have available. At the moment I have a TheraBand. I've got to be resourceful sometimes. So what I'm going to do is pass this to Julian.
And what are we looking at in this very first part of the assessment?
So the first exercise, what we're going to look at is just a simple squat. What a squat is a very, very basic movement. It involves the opening and closing of your ankles, knees, hips, and also quite a bit of movement in your low back and your mid back, your thoracic spine.
So it's a lot of areas that we're looking at then in the single movement.
Yeah, so it gives us a pretty big picture, like the 30,000-foot view from a plane, see what may or may not be going on.
Okay.
We also put in the overhead squat to see what's going on with shoulder movement. So it's almost like one test, one kind of quick, almost dirty test to say, all right, I can see this test, and then I have the opportunity to start to pick it apart. So what we're actually going to have Julian do is put the band over his head with his elbows bent, like directly over his head, just to make sure I'm just making sure that he's all in the right line. Then what's going to happen is Julian's going to put his arms straight up, right, and his toes pointing more or less forward. Okay, so he's done this before, so it's not dangerous. I'm going to have him squat as deeply as he can. Okay.
And now I just want to stop you for a sec. A lot of people are afraid of squatting below, that point. So what would you say about that at this point?
Well, Julian, having squatted quite a bit, stay down there, man. Let's show people it's safe. Okay, so squatting down to that point, what we actually have in any joint is synovial fluid. Synovial fluid brings a lot of nutrition to the cartilage. The cartilage in your joint is like your shock absorber. You can come up now, Julian. I don't want to make you too tired while I talk too much. What ends up happening is there's no blood flow to that, most of the cartilage. Some pieces of cartilage have a little bit of blood flow. Without free movement of a joint, we don't provide nutrition and fluid exchange to the deeper portions of that joint. We will then end up oftentimes having, your itis conditions, your tendonitis, your bursitis. We don't really want to promote those. So without free range of motion, oftentimes we will end up with more pain. So going through that nice full range is very important, as we want to make sure that the joint is working well, that we're having that fluid exchange, that everything's working nicely.
So it is safe then to be doing a full squat as opposed to a half squat?
For most people it is. Obviously in special circumstances when people have pain, if you can't make the movement, and again, as I alluded to before, what I want to do is I always want to make sure what a person can do. So I want to see how far they can go on their own.
Okay.
If I don't see how far they can go on their own, then I can't tell them it's safe. Okay. For most people that can get down there, it's very safe. It's a great idea. It's a great way to maintain the health of your joint. It's not impactful as long as you're doing it in the right mechanic. We're not putting extra strain on the knee. If we are doing it in a way where the knees shoot straight forward, we're negating hip flexion. If we negate hip flexion, movement of the hips back and forward, we put more strain on the knee. We've taken a part of the movement out. So as long as somebody's moving safely, and I see that they're moving safely, it's very good for you. If
Okay.
somebody is moving in an unsafe way and putting undue strain on their knees, they're showing me a behavior pattern where they don't have the neural drive to make the movement happen properly. Their nervous system isn't firing and the muscles aren't cooperating. So
Okay.
my job then is to break it down and provide them with the proper mechanics and proper intervention to make sure that it's safe.
So what were we seeing there with Julian's squat? What can you tell us
Okay.
briefly about what's going on with his
Okay,
movements?
so what I'll have actually Julian do, so that the camera can pick it up a little bit better, I'm going to have Julian face me and perform the movement again. So he's going to put his arm straight over his head, all right, straighten up his arms, nice and tall, and he's going to do the squat again. Okay, so now with Julian, what ends up happening, it's pretty clear that his arms pop forward. When his arms pop forward, that shows me that there's something going on with his shoulders. He doesn't have the same range of motion as is ideal. Ideally, we'd want it to be behind his head, so we can ask him to force it behind his head, but he's not going to do a good job. I mean, we got a band.
It's not
so
very natural.
no,
looking.
it's not very natural. He has a hard time with it. He can do it, but he has a hard time with it. Now, we also see that, so if Julian, you can stand up again, and I'm going to get you to squat one more time. So go ahead, nice and slow. As we watch him go down, if you watch kind of his glute area, go down a little faster, you're going to see his glutes pop forward a little bit.
And what does that mean?
What that's showing me is a little bit of flexion of the lumbar spine, which in this case is not always the most ideal situation.
Okay.
So I would want to kind of go in and figure out why that's happening. So more testing, as often happens. You know, I want to really know what I'm dealing with before I make a good suggestion.
And I mean, what's going on? What are we seeing potential for low back pain in the future? Why is this a problem for the everyday person?
Well, the everyday person, if they've got a less than ideal squat, as just a general movement, now this isn't going to be the appropriate test for everybody, but if they have a less than ideal squat, what we're seeing, at least with the lumbar spine, is hypermobility. So it doesn't stabilize itself as well in movement as it could. When it doesn't stabilize itself as well, it isn't adapted to moving through full range of motion, through protecting itself from stress. It's not as well adapted as I previously said.
Okay. Okay. So is there any other information we're picking up here, or are we ready to move on to the next test?
We're ready to move on. As we noted, his shoulders kind of move forward. Ideally, we want his shoulders to be able to pull back in that position.
Right.
And we also don't want him to lean too far forward, as he kind of did. It wasn't terrible. He's actually pretty good compared to some others. But we want to look at what's going on with his shoulders. So actually what I'm going to have Julian do is just put the band straight above his head. So arms nice and straight. What he's going to do is he's just going to kind of pull down towards the back of his neck. So we're looking at downward rotation of the scapula, and we're going to have him pull his arms up again and do it one more time just so everybody sees. It's actually not showing up as well on camera, but what ends up happening is you can see that his right arm is a little bit lower than his left arm, and they move at a slightly different speed. So go again, Julian.
Why would this be?
Neural drive again. So there's some kind of adaptation that's happening, so you can relax.
Would that be because he's right-handed, left-handed? Does that affect it?
It can, definitely, because if you're using one muscle or one arm more than the other, what will end up happening quite often is you'll adapt to use that more. The other one won't have as much nervous flow. There could be restriction, as was being said in the previous segment by the osteopath, of fluid dynamics, of blood flow and nerve flow. So when that happens, the muscle doesn't work as well. Now in Julian's case specifically, only because I know I can shed a little bit more light, because I train him as a sprinter, he's constantly running in one direction around the track. We need that adaptation so that he's actually efficient in running around a corner, because he does run 200s at times. So what's actually ended up happening is he's developed a muscle imbalance to make him more efficient. So sometimes imbalances are good, sometimes they're bad. For Julian, we need to maintain that stability and maintain that efficiency. But what ends up happening is you will see differences in the arm. So we don't want to let that go too far. We've got to keep it in check by doing balance exercise. So quite often he'll run the other way, as an example of something that we can do as a corrective exercise to make sure the imbalance doesn't go too far.
And that's what I wanted to touch on very briefly. What are we doing with all this information? You're going to develop a plan for them essentially via exercise?
Most definitely. I'm going to develop a plan. Once I have all the information, I've got to have the big picture. I have the big picture. I will then put together a plan and say what makes the most sense for this person for their goals. So I need to know your goal and your one goal, because we can only really work on one at a time. It's kind of hard for somebody to lose weight and gain a lot of muscle at the same time. The body just doesn't work that way. It's hard to get faster or more powerful and have a lot more endurance. They don't fit together very well. So what we end up doing is getting all the information, making a nice big picture plan as far as how the joints are functioning, because that does relate to health, and it does also relate to what may end up breaking down in the future.
Good to know. Is there another test you want to run through? We've got about 2 minutes
Yeah,
left.
what we're going to do is just show, again, a pretty simple one. a lot of people tend to complain of pain in their hamstrings. So we're actually going to have Julian help us move the massage table out here so we can show him. Or actually, I'll do it myself. Okay. Now, we're going to have Julian lay down with his head here. So get on down there. So we're just going to have him doing straight leg raises, right, to see what kind of range of motion that he has in his legs on his own. Again, I don't want to stretch him because if I do, then I take away the ability to know what's going on. So I'm going to have you raise your right leg nice and straight as far as you can. You got pretty good range of motion. He's at 90 degrees, which is exactly what we want. It's more than we need, but it's what we want. It's more than we need to walk, but we want as much as we can so he's an effective sprinter. So we're going to have him go with his left leg. All right? And on account of it just doesn't show up as well on camera. He's shaking a lot more on his left leg. He's having a lot more trouble, so the muscles aren't responding as well to the nervous drive. So what I'm seeing is that there's a difference and an imbalance. So that would be something that I'd want to go in and investigate a little bit more, a little bit deeper, so that I can then develop a plan to make sure that the imbalance doesn't go too far.
Okay, and any ideas why that might be, that one leg is imbalanced?
With Julian, again, he often, as a sprinter, will start off with one leg forward. In his case, it's his left leg. And it's also running around the corner in one direction. With that being said, he's developed an adaptation to be a little bit more efficient and just get better at it.
Okay, so it definitely seems like there are some imbalances for some people.
Yeah.
And the whole point is, let's individualize this. Let's ensure that you're working with somebody's goals, right?
Yeah, most definitely. So I need to know your goal. I need to know what's going on with you. So I need to take a big picture assessment, step back, get the whole idea, then work with within what your goals are. So I've got to relate it all. It's on a continuum, but I've got to make sure that I'm doing the right thing for the right reason. I don't want to just give you general exercise if you have a specific goal. If you have no goals and you just want to be healthy, I'm going to give you general exercises.
Okay, well, I like that. I like that you are planning out what they need to do. Well, thanks so much for coming onto the show, Sam. You showed us what an assessment looks like, or at least part of it.
Yeah.
I mean, people can get in contact with you on the information on the show.
Yeah.
So we've taken a look today at moving right for health. We'll join us next week on Health Matters. Bye for now.